put my screen on. All right, as you guys are coming in, hello, hello, hello. Happy Thursday. All right. I am bringing up why we are here, aka NCLEX Jeopardy. Okay. All right, you should see Mona Lisa. Don't worry about Mona Lisa. Mona Lisa about to go away in just a second. Okay, cool. Here we go. All right, guys. Hello, hello, welcome. Happy Thursday. It is time for NCLEX Jeopardy. Okay, with Nurse Sam. That's me. All right, so if this is your first time participating in NCLEX Jeopardy, please introduce yourself down below. Comment that this is your first time. Let me know you're a first timer so I can give you a warm welcome. So I can give you the rundown of how we operate and how we do our NCLEX Jeopardies on Thursdays. If you're a repeat offender, if you usually come, welcome back, boo. Hey, how you doing? Okay, just a little update. I don't know if you guys were with me last Thursday when we did NCLEX Jeopardy, but there were a few people, I know at least one, who was saying that they were taking their NCLEX like the next day. Her name was Esther. Just want to let y'all know. Okay, as we all suspected, she definitely passed. She is a licensed nurse now. Woohoo! All right, so if anybody else has any praise reports, past reports to share, please do not hesitate. Please let me know. Tag me, send me a DM, send me an email, whatever it is. I want to help you guys celebrate, and I want to celebrate you guys for obviously passing whatever your finals, your NCLEX, your exit, HESIs, predictors, all that. We celebrate all the wins, big, small, and everything in between. Okay. All right. So hello to my first timers. Of Ariana. We have Rachel, I believe. Hey Chelsea, I'm buying a bundle today. Great. Oh, also, by the way, if you guys have not already taken advantage of our day 2 deal, all right, it's 12 days of NCLEX every day for the next 12 days. Well, 10. We have a different deal every day. You don't know what deal it's coming until the actual day. Drops at midnight Eastern Standard Time, and the deal literally lasts the entire day. No code necessary. You just got to add the items that's on sale or that's discounted. Just add them to your cart and you'll receive the discount applied automatically. Okay, so for today, which is day 2 of our 12 days of NCLEX, nursing gift to me, $25 Ultimate Nursing School bundles. I know. Call me Sammy Claus, Nurse Sammy Claus. That was cheesy, but not too bad. All right. So yes, $25 Ultimate Nursing School bundles for you guys. What's today? It's 7 o'clock. So you have less than 5 hours, a little bit less than 5 hours to get your Ultimate Nursing School bundles. They're regularly $97. Okay. They are digital / printable. Okay. It's all available digitally, but you have the option to print it, but you have to first buy it digitally. And now that you're getting it for $25, you can go ahead and print that thing. Okay. So, like I said, $25 Ultimate Nursing School bundles. That's like $72 off. Get your life. Link in bio or thenursesam.com. It's also available in app as well. Okay, so let's get into why we are here. Just want to give you guys some announcements real quick. All right, so for all my first timers, like I said, welcome to NCLEX Jeopardy. A little bit about me. I am Nurse Sam. I'm a licensed practical nurse and have been so since 2014. After a major surgery, I had a hysterectomy. in 2018, I literally physically could not do bedside nursing anymore. So I had to get creative, and that's literally what I did. All right, I created, and it's going on three years, or over 3 years now. I created a digital space for nursing students, RN and LPN, to be able to feel supported and to get the resources and aids they need to learn, comprehend, retain information faster while having fun doing that. Okay, so the nursesam.com, I am your CEO, Nurse Sam. And so that's our mission. Okay, we created NCLEX Jeopardy about 2 years ago, and that's our weekly practice review for NCLEX style questions. I don't know about you guys, but if I'm not entertained when I'm studying, I will not remember anything. I will not retain it, nothing. So when I was studying for the NCLEX, every time we would do some kind of game show inspired, like friendly competition type thing, I would excel. That's just the type of learner I am, a visual learner, and I'm a kinesthetic learner. So I incorporated that into our NCLEX reviews, and NCLEX Jeopardy was born. Okay, so how this works is just like you guys can see the screen behind me, you'll be able to see the questions and the answer choices. Okay, these are our topics. These are our 5 topics. For this week, we have pharmacology, pediatrics, mental health, fundamentals, and adult health / like med-surg. Okay, within each category you have 5 questions, each ranging from 100 points to 500 points. How we're going to play is that as I bring up the questions, the first person to correctly answer the question in the style of NCLEX Jeopardy, so you have to say question style, you have to say what is. All right, the first person to say what is and answer the question correctly on my screen is going to be the winner of those points. Okay, every nursing student for themselves. All right, it can be anybody's game. You can come in towards the end and just get like 2 500 pointers and boom, you got it. So but let me say that even though we are playing for prizes, the person with the highest amount of points at the end of the game is going to win a free digital Ultimate Nursing School bundle. All right, if you don't win, like I said, it's okay. You still can get it for $25, the Ultimate Nursing School bundle. All right, our 400-page bestseller. But I want you to know, please note that this is just a gamification to an NCLEX review to make it fun, to help you guys be entertained so that you retain more of the information so that you're able to recall it faster when you actually need it on the actual NCLEX. All right, so the actual NCLEX is not Jeopardy style. It's not game show style. You don't have to be the first person to get it correct. As long as you get the answer correct within the allotted amount of time, you're good. Okay, so as we play, even if you're here just for the review and you don't really want the points, if you're just here for the review and you're getting the answers correct, even though you're not the first person, as long as you're getting it correct, you are on the money. You're actually winning, okay? We're testing comprehension just to make sure that no matter how the NCLEX throws you a curveball, okay, with clinical scenarios and questions, you're able to still able to make appropriate clinical decisions, make sound clinical judgments, and select the correct answer, all right, no matter what the situation is. All right, so once again, you have to answer the question in what is style. Okay, if you just go ahead and just copy and paste what is to go in here, you can shave a couple seconds. All right, this is for RN and LPN. All right, RN and PN or VN students. All right, both RNs and LPNs have to take the NCLEX, and per the test plans for the NCLEX, both previously and currently. All right, the education and the material that's being covered on the NCLEX is very, very, very similar, like 99.2. All right, anything else that differs is just because of like delegation, and that goes without saying. All right, so you still got to know signs and symptoms of diabetes, the nursing considerations, all that stuff. You still have to know whether you're an LPN, LVN, or RN student. Cool, so you can join in. Like I said, if you want to play for points, you have to say what is. If you're just here for the review, just to have some fun, you can just answer. But I know that whoever has what is in their answer is really trying to get the points so they can win a free Ultimate Nursing School bundle. All right. Does PA or do PAs have to take the NCLEX? No, the physician assistants do not have to take the NCLEX. NCLEX is strictly for nurses, so that's RN or LPN/LPN. Okay. All right. So if you guys are ready, if you guys got the house rules, all right, if you got everything under wraps, if you're ready to play, give me a thumbs up in the comments if you are ready for the first question and for us to start NCLEX Jeopardy. All right, give me a thumbs up in the comments if you are ready to play. And if you know anyone that's either studying for their finals, if they're studying for the NCLEX, Exit, HESI, any of that, and they just want a free and a fun review, go ahead and tag them. All right, you guys are scrolling on TikTok anyway. All right, might as well learn while you're doing it. All right. Let me see what you guys are saying. Teresa said, I want to thank you and your nursing, I want to thank you and your nursing bundle. I passed my NCLEX. Woo, I'm officially an RN. Thank you so much. Woohoo. Proof that it works for RNs and PNs, okay? Congratulations, Teresa. Teresa RN. I know that's right. All right, guys, I'm getting thumbs up. So that means you guys are ready. All right, let's go ahead. Once again, if you're just now coming in, if you want to play for the points, make sure you put what is and answer the questions in what is style, question style. All right. Taking my NCLEX Monday. Awesome job. You're right in time. All right, guys, first question. Let's go ahead and get into it. Question number 1. And I posted this maybe like 30 minutes ago. All right, question number 1. It is pediatrics for 300. Let me get my head out the way. My fault. Hold on. Wait. Okay. Wait. There we go. All right, there we go. Pediatrics for 300 points. The nurse is providing anticipatory guidance to the mother of a 10-month-old child. The mother asks how soon her daughter will be able to receive the chickenpox or the varicella vaccine. What is the best nursing response? 1, she will receive it today. 2, she can receive it when she is 12 months old. 3, she can receive it at any time before her first birthday. Or 4, she will receive it before entry into kindergarten at 4 to 6 years of age. What is our answer? Remember, if you want to play for points, say what is. If you're just here for the review, just go ahead and just answer, all willy-nilly. All right. Let's see I'm getting lots of 2s and 4s. I'm getting a 3 here and there, but I'm getting a majority 2s. And then I see like 4s. A lot of you guys say 2s, all right? If you guys follow me on that other app that starts with an I and ends with an M. Yes, okay, good. I posted something about a very fun and tasty way to remember pediatric immunization schedules. And I made sure to include this question in tonight's review just to see if you guys are paying attention to my content, okay? All right, so if you don't know that, make sure you guys go back and check out that post, save it for later reference. But let's see what this answer is now. I'm still looking at answers. Hold on 1 second. All right, and drum roll please. Our answer is wait for it. Okay, our answer is what is 2? What is 2? She can receive it when she is 12 months old. All right, says rationale says the varicella vaccination is recommended to be administered when the child is between 12 and 18 months of age. Therefore, the remaining options are incorrect. And number 2 is the correct one. All right, so yes, 12 to 18 months. If you guys have the Ultimate Nursing School bundle, right after the pediatric study kit section, you should have like a McDonald's inspired immunization cheat sheet that's like 3-4 pages, I believe. And it shows the required pediatric immunizations and when they're due, according to, and they're classified and grouped according to like the age range, which is how I recommend you remember this. Okay, because the NCLEX is going to give you a scenario just like we had right here, where they give you the age of a client. You have a 10-month-old, you have a 4-year-old, you have a 3-year-old. And it's up to you to be able to recognize that that age is a very important part of the clinical scenario, and it's going to ultimately, determine which immunizations and vaccinations are due based on that age. All right, so if you need like cool mnemonics to help you remember the age range and the immunizations due, make sure you check out that cheat sheet within the Ultimate Nursing School bundle. Okay. All right. First person to correctly answer and say what is. All right. So the first person to say what is two is Jinroa, Jinroa. All right, congratulations, General. You are on the scoreboard with 300 points. Awesome job. For everybody else that got what is two, awesome job. Like I said, even though you're not first, you didn't get those points, as long as you're correctly answering the questions, you're getting the gist. You're getting the point of why we're doing NCLEX Jeopardy. All right, so really make sure you guys are comprehending the information and you're not letting the overwhelm of 50 questions or UWorld or Hearst Review. You're not letting that overwhelm kind of kick your test anxiety into overdrive and you kind of blank out. So this is just a fun way to almost make you want to study, be entertained while you study. Okay, make sure you are noting the rationale, especially if you get the question wrong. It's literally the answer right in front of your face. It's a great little review. I always say practice questions are a great way to prepare for any test, any exam, no matter what. So make sure you're noting the rationales, okay? Great job to everyone that got what is two. All right. Next question. And let's see what we got. I keep doing this wrong. Boom. Wait. Okay, here we go. All right, next question. What is this? Mental health. Mental health for 400 points. Let me scroll all the way down. All right, the nurse is reviewing the record of a client scheduled for electroconvulsive therapy, or ECT, to treat depression. Which medical diagnosis, if noted on the client's record, would indicate a need to contact the psychiatrist scheduled to perform the ECT? 1. Type 2 diabetes mellitus. 2. Peripheral vascular disease. 3. Recent myocardial infarction. Or 4. Newly diagnosed hyperthyroidism. What is our answer? A great way to prepare for the next gen NCLEX, even though this is current NCLEX format. All right, remember the NGN will have a mixture of both new items and the traditional items from the current NCLEX. So don't think it's a completely new NCLEX. You still have to know your foundation. You still have to know majority of the of how to answer the current and traditional NCLEX style questions. All right, whenever you have a question like this that is multiple choice, make sure you reread the last line so you can kind of be reminded of what the question is actually asking you. And then if you're preparing for the NGN, ask yourself why you chose the answer you chose. So make sure, even before we see the rationale in your mind, kind of test yourself to make sure you understand why you chose the answer that you chose. Because once again, the next gen NCLEX is really focusing on measuring clinical judgment. All right, and the best way to exhibit clinical judgment is to kind of prove that you understand, based on evidence, why you're doing certain actions, why you're doing certain interventions, why certain interventions can't be done. So the why is very important when it comes to, really understanding the content. Sorry, really understanding the content. And yep, there we go. All right, so let's see what our answer is. Getting lots of threes, which is recent myocardial infarction. Lots of threes. Someone said a 2. All right, so let me scroll all the way up, and then we're gonna see what our answer is. Drum roll, please. Okay, here we go. And the answer is, what is 3? Recent myocardial infarction. All right. Dang, I should have asked y'all why before bringing it up. But why did y'all choose the answer you chose? Whether you chose 3, 2, 4, what was it that went through your mind that convinced you that the answer was what you chose? Okay, so you want to compare your reasoning with the actual rationale that they provide, just to make sure they're lined up and they're aligned. So you really, you can confirm, you can make sure that you have a good grasp and understanding of the content. All right, so what is 3? Recent MI or myocardial infarction. This says several conditions present risk in the client scheduled for ECT. All right, remember that's electroconvulsive therapy used to treat depression. These include recent myocardial infarction, stroke or brain attack, and cerebrovascular malformation or an intracranial lesion. The conditions and the remaining options do not present specific risks associated with ECT. Okay, so why do you think, taking this a step further, but why do you think those specific conditions would present a risk for somebody getting electroconvulsive therapy? They're getting electricity throughout their whole body. Okay, so added electricity, they're getting jolted, shocked. Why are these 3? Why do they present a risk for anyone that's about to get vaulted? Okay, what is it about those 3 that make it risky, specific to the electricity? Right, the shock could affect a heart that has already recently had dysrhythmia, or what did you say? Trauma, okay. I do. Pisces Rush. Do you have anything that explains the differences between the old NCLEX and the new one? Yes. Click the link in my bio and you will get a little mini guide explaining the differences between the current and the new one. Future ER nurse said because if they're having heart problems, then it could be a problem with shock. Remember, the heart is electrically charged. Okay, remember that. So all your lub dubs, okay, the SA node, all that good stuff, that is initiated based on shock. So if you are administering like an extra shock, especially one, I guess as strong as you would get with ECT, any type of disruption into an already electrically charged process, it's gonna throw it off. It's gonna cause dysrhythmias. It's gonna cause, like a disruption in the normal functioning. So it's kind of like the same thing with the reason why they tell you to like clear off a patient when they're about to, shock and do, what's this called? When they shock you during like CPR, resuscitation. They tell you to clear because if you are touching that patient and you get a little bit of that bolt and that shock into my fault. More than likely, it's going to disrupt the rhythm of your heart, and you're going to have dysrhythmias, pass out, all that good stuff. It's life-threatening. Okay, so it's kind of like in the same. It's the same thing, pretty much, of why those specific things present a risk. Okay, wait for it. So the first person to get what is 3 was I just had it. Hold on. I'm scrolling all the way up, making sure I see all the answers. I don't want to call somebody's answer. Sierra is rich. That's who it was. All right. Congrats, Sierra is rich. And now you are 400 points richer. Awesome job. All right. So Sierra, with that, you are now in the lead with 400 points. And then Jinra, you're right behind her with 300 points. It can still be anyone's game. We have half an hour. So make sure you are putting your best foot forward. All right. Next question. AED, thank you, defibrillation. Thank y'all so much. All right, next question, let's do it. Pharmacology for 200. Pharmacology for 200. The nurse should report which assessment finding to the primary healthcare provider before initiating thrombolytic therapy in a client with pulmonary embolism. 1. Adventitious breath sounds. 2. Temperature of 99.4 orally. 3. Blood pressure of 198 over 110 millimeters of mercury. And then 4, respiratory rate of 28 breaths per minute. All right, so which of those findings would alert the nurse to bring that to the attention of the provider? Okay, our situation is that they're about to start thrombolytic therapy, okay, in a client with pulmonary embolism. All right, so you guys know what pulmonary embolism is, right? They have a blood clot, a moving blood clot in their lungs, and they're about to administer like a clot buster to help break up that clot. So which of these findings would not, which of these findings would, like I said, alert the nurse that something's not right, or this should be double checked? All right. Adventitious breath sounds. If you guys don't know what adventitious means, it means like abnormal. So whenever you see adventitious breath sounds, you think about like crackles, wheezes, rails, stridor. All right, so anything that is, like I said, abnormal and besides besides normal, adventitious. So A, adventitious for abnormal. 2, 99.4 temperature orally, a BP of 198 over 110, that is super high, and then a respiratory rate of 28 breaths per minute. So that is consistent with hyperventilation. All right, so which of those is a no-go? Which of those would be important to note before initiating a clot buster to eliminate a clot that's located within the lungs? All right, so what is that answer? Getting lots of 3s and 4s. Getting lots from you guys. So you guys are either saying super high BP of 198 over 110 or a respiratory rate of 28. Okay, majority of people saying 3. Let's go ahead and see what the answer is. All right, now while I'm bringing up the answer, tell me why the answer is number 3. I saw somebody kind of said that this is a medical emergency. Life of LMA said it's 3 because 4 could be an expected finding with a pulmonary embolism. 190 over 110 is not good. Definitely 3. I'm not a nurse. I just want to know the answer. All right, let's look and see what the answer is. And it is what is 3, a blood pressure of 198 over 110. All right, so rationale-wise, thrombolytic therapy is contraindicated in severe uncontrolled hypertension because, another why, of the risk of cerebral hemorrhage. Okay. Therefore, the nurse would report the results of the blood pressure to the PHCP or the provider before initiating that therapy. Okay, so that BP being that high, that's like stroke level high. Okay, that is stroke level high. So what you don't want is, especially with, like I said, with the severe uncontrolled hypertension, you already have a pulmonary embolism, which is a blood clot in your lungs. If for some reason that traveling blood clot goes to your brain, all right, that's when you can start to exhibit stroke-like symptoms, one of which is uncontrolled severely high hypertension. All right, that thrombolytic therapy, once again, is contraindicated. You cannot give thrombolytics with somebody that has that severe and uncontrolled hypertension, because that will then go and bust up that clot. Okay, and that will then increase the risk of cerebral hemorrhage, which is just out of control bleeding in the brain. Make sense? First person to get what is 3 was, wait for it, hold on, Smell and Adam. Melinda Adam. I don't know how to, what's your name? Smell and Adam. I think that's what it is. But yes, you are the first person to answer correctly and say what is 3. So you are the winner of 200 points. All right, perfect. All right, great job to everyone that got what is 3. If you didn't, like I said, just make sure you note the rationale. If you have any questions, just drop them down below. Lives of LMA said, would the respiratory rate be expected in that situation? If BP was norm, would we alert the healthcare provider still? Yeah, so that respiratory rate being elevated, that would be an expected finding, especially in a client with pulmonary embolism. Okay, so remember, with pulmonary embolism, you're going to expect them to kind of have some dyspnea, which is difficulty breathing. They might be trying to overcompensate or compensate for the fact that they can't really breathe. They're having difficulty breathing, and that's going to result in them breathing faster, which is the hyperventilation. So you can expect for that respiratory rate to be higher in someone with pulmonary embolism. Okay. Perfect. All right, next question, guys. Right, Kendall. That was a great question. I hope y'all are taking notes, okay? So another reason why I love doing the group, why am I so big? The group review / tutoring session, because we all learn from one another, whether it's somebody having a really great question and getting answered that maybe you didn't think to answer, or some people are too scared to answer. We're all kind of learning off of each other. All right, next question. Okay, adult health for 500. Adult health for 500. All right, the nurse is caring for an older adult, who has been placed in Buck's extension traction after a hip fracture. On assessment of the client, the nurse notes that the client is disoriented. What is the best nursing action based on this information? 1, apply restraints to the client. 2, ask the family to stay with the client. 3, place a clock and calendar in the client's room. Or 4, ask the laboratory to perform electrolyte studies. What is our answer? 500 points. This is one of the big ones. All right, you get this right, you automatically go to first place. All right. So make sure you are reading through the question and kind of noting the things that are important within this clinical situation. All right, we're caring for an older adult, okay, who's been placed in a type of traction called Buck's extension traction after a hip fracture. Okay, now during assessment, the nurse notes, that's future you, okay, the nurse notes that the client is disoriented. All right. Now remember, during assessment, you're checking for, you're checking you're doing your neuro checks and trying to make sure that they are oriented to, time, place, person. What's the fourth one? Person, place, time, person, place, time, situation. There we go. Make sure you're trying to make sure that they are A&O, or alert and oriented, times 4. If the finding is now disorientation, all right, that means, that patient is not, they're a little bit confused. All right, they're starting to show some confusion. So based off of this assessment finding, what is the best nursing action? All right, little hint. Whenever you see a question that says what's the best, what's the most important, what is the priority, those words, those little trigger words, more than likely you're going to have answer choices that are all correct, or majority of them can be correct. You're looking for the literal best answer specific to this situation. All right, specific to the clinical situation that they give you, not just a textbook answer, not that. All right, that's why it says based on this information. So you gotta be a Scooby-Doo a little bit, Nancy Drew. Go back and really dissect the information that they're giving you and really kind of just think clinically. Okay, what is that answer? Let's say I'd say 1 of 4, so the answer right. Altered mental status, there we go. All right, so the answer is, looking at what y'all saying. I was thinking of it. All right, so answer is what is 3? Place a clock and calendar in the client's room. The answer is 3. Okay. All right, let's see who got 3 first, and then we're gonna go through it. Remember, when you're taking these questions, you want to give yourself about no more than 2 minutes to answer these questions. So even though this is on a live, I'm gonna give the 1, maybe max, like I said, maybe max 2 for those that maybe take longer to read through the question and actually answer. So just because, even though this is a game of speed, just for fun, I still want to make sure that everyone has a fair shot of answering. Okay, so if I am going too slow for you guys and y'all just want the answer, go ahead and download the app, the Nurse Sam app. It is free to download. You can play all 25 questions on your own without me having to talk and wait and I'll do all this stuff. So if you don't want to be bothered and you just want the review, download the Nurse Sam app. Link in bio. Like I said, free to play, free to download, 25 new questions. Okay. All right, first person to answer what is 3 first. A lot of people said what is 4, and we're gonna get into it. But a lot of people said what is 4. First person to say what is 3 is J Ari 97. J Ari 97. Great job. You are on the scoreboard with 500 points. All right, so this is what the rationale says. It says an inactive older adult may become disoriented because of lack of sensory stimulation. the most appropriate nursing intervention would be to reorient the client frequently and to place objects such as a clock and a calendar in the client's room to maintain orientation. All right. Restraints may cause further disorientation and should not be applied unless specifically prescribed. And then agency policies and procedures should be followed before the application of restraints. The family can assist with orientation. Oh, wait, my face, sorry. The family can assist with orientation of the client, but it is inappropriate to ask the family to stay with the client. It is not within the scope of nursing practice to prescribe laboratory studies. So that's why 4 was not the answer. The answer is 3. I think the big takeaway from that, because a lot of people, I can already tell, but I can already tell based on your answers that you thought, a lot of you thought that the confusion or the disorientation was probably thinking UTI, some type of like infection, which due to the immobility UTI, there is a risk of UTI, but this is why paying attention to the way the questions are asked is very, very important. Hold on, let's go back to the question and see what it says. Right, so number 4 said, ask the lab to perform electrolyte studies. That's why number 4 was not the answer. If number 4 said, what is the best nursing action based on this information? Maybe ask the provider to prescribe electrolyte studies. Ask for a prescription, not ask for the action as if you're prescribing it, because nurses, whether RN or LPN, that's not within our scope of practice. Okay, we cannot prescribe medicine studies, imaging, none of that. Because the question did not let us know that there was like maybe a PRN or a standing order for labs, I don't know. We can't assume that we do. Okay, we have to go based off of the information given to us. So that's why number 4 was not the answer. All right. Hold on, let me see what y'all are saying. Makes sense. Okay, perfect. Let's go to the next one. Sorry, I want to do this one. I lied. Sorry, my fault. We're doing this one. All right, adult health for 100. My fault. Don't submit your answers. All right, we're starting over. This is the new question right here. Adult health for 100. This is a new question. All right, so everybody after JRV 97, I said what it's to. Your answers now should be for adult health for 100. Okay, my fault. Don't cuss me out. I love you. All right, a client is admitted to a hospital with a diagnosis of diabetic ketoacidosis, or DKA. The initial blood glucose level is 950. A continuous IV infusion of short-acting insulin is initiated, along with rehydration with normal saline. The serum glucose level is now decreased to 240. The nurse would next prepare to administer which medication? 1. An ampule of 50% dextrose. 2. NPH insulin subcutaneously. 3. IV fluids containing dextrose. Or 4. Phenytoin for the prevention of seizures. All right, so based off of all that, the nurse would next prepared to administer which medication? What is our answer, y'all? We got a client with DKA. I'm seeing 3s. I'm seeing 2s. What's our answer? All right. Let me go ahead and get the answer. Well, let me see. Right back. All right, so our answer is, what is 3? IV fluids containing dextrose. I want y'all to tell me why. My fault. I keep forgetting to ask y'all why y'all chose the answer you chose. But as long as you kind of like know, and at least on the inside, why you chose the answer, you'll be good. If you're just doing it because you see a lot of people just choosing the answer, it's gonna hurt you in the long run. Don't even let this be practice to ignore the noise. If you're sure about an answer, go with the answer that you're sure about based on your gut. All right. Like I said, the answer is what is 3. First person to say what is 3. And remember, you have to say what is if you want the points. If you just want the review, just say 3 or just say the answer. But if you want the points, say what is. First person to say what is 3. Lots of people said 2. Lots of people said 2. Lots of people said 2. Hold on. And even though a lot of people did say 3, no one really said what is 3. Hold on. Wait for it. Sierra is rich. First person to say what is 3. Ooh. Sierra is rich. All right, Sierra, you are already on the scoreboard with 100 points. So you just got an extra 100 points. So now you have 500 points, which means you are tied with J. Ari 97 for first place. All right, we still have about 10 more minutes, so we have another question to break this little tiebreaker. But let's go ahead and get into why the answer was what is 3. All right, so for you guys that said 3, congratulations, you still got the answer correct. All right, I'm just talking about the points. You didn't say the correct format for the points. But if this was the NCLEX, you would have got the answer right. All right, a win is a win. A win is a win. All right, so this says, emergency management of DKA or diabetic ketoacidosis focuses on correcting fluid and electrolyte imbalances and normalizing the serum glucose level. All right, so DKA is just like when your blood sugar is super high. This is what happens when you have uncontrolled hyperglycemia for a long amount of, extended amount of time, to the point where, your ketones start spilling into your urine, and, you can possibly go into coma. So that's just super high DKA. Super high blood sugar. That's what DKA is. All right. So if your blood sugar is super, super high, then your treatment would be something to bring that down, correct? So your goal is to correct that blood sugar level. All right. Now, what's important is that if the corrections occur too quickly, like that drop in blood sugar, if that occurs too quickly, even more serious consequences can occur, including hypoglycemia and most notably cerebral edema. All right, those things can occur. On the NCLEX, when it comes to the reasons why you don't want to correct the blood sugar, you don't want to change that up too fast. One of the main reasons why, and the commonly found reasons why that they at least have for the NCLEX is the cerebral edema. Even though it's both, hypoglycemia and cerebral edema, my 2 years of doing NCLEX Jeopardy every week, I've seen cerebral edema be tested more so than the hypoglycemia. So know both, but make sure you know that cerebral edema is one of the serious consequences that can occur if that blood sugar correction happens too quickly. All right, then it says during management of DKA, when the blood glucose level falls to about 250 to 300, remember, I think the client started off at the 950 as far as their blood sugar. When that falls to 250 to 300, the IV infusion rate is reduced. All right, so it's infusing in at a slower rate, and a dextrose solution is added to maintain a blood glucose level of about 250. All right, so that's to combat it dropping too quickly. Add just a little bit of that dextrose back in. Okay, instead of salt-based, dextrose bay. Okay, And then it says, oh, and then it says, or until the client recovers from ketosis. It says 50% dextrose is used to treat hypoglycemia, and the NPH insulin is not used to treat DKA. The phenytoin is not a usual treatment measure for DKA. The phenytoin was to, prevent seizures, but the seizures are like a side effect or a consequence of DKA, but you wouldn't give phenytoin unless you had to. It's not like a preventative medicine in someone with DKA. All right. So what helped me remember DKA, like the treatment for DKA, I remember literally DKA. All right. The D stands for dextrose. The K stands for add potassium, and that really stood for correcting the electrolyte imbalance, or the electrolyte loss. But the most notably, you want to add that potassium back in once again, just because of the electricity, towards the heart and the rest of the body. But yeah, and then the A is for administer fluids. So D dextrose, K for potassium, and then A for administer insulin and fluids. Administer insulin and fluids. That's the treatment for the emergency management treatment for DKA. All right, so great job to everyone that got what is 3. Hold on. This is a good one. Perfect. Okay, next question, guys. I'm glad that mnemonic helps you, because it super helps me. Last question. Hold on. Last question, guys. Wait for it. Okay, let's do, I think that's it. Yep, pharmacology for 500. All right, this is our last question. It's 500. It's our oh, that's Family Feud. That's not even Jeopardy. But this is our boss level question. Sure, 500 points for pharmacology in our last question. All right, I can't pronounce this medication, so don't judge me. Quinupristin, dalfopristin. Girl, this medication right here is prescribed as an intermittent intravenous infusion. The nurse should adjust the drip rate so that the dose is administered over what period of time? 1 hour. 1 hour. 2, 4 hours. 3, 15 minutes. Or 4, 30 minutes. That probably should have been like ABCD, now that I think about it. But yes, 1 hour, 4. I feel crazy saying 1 hour, 4 hours. 4 hours. So 1 hour, 4 hours, 15 minutes, or 30 minutes. The nurse should adjust the drip rate so it's administered over what period of time. This medication right here, quintuplets, dalfopristin. All right, what is that answer? I'm looking at what y'all saying. People saying what is 1. Some people are saying what is 4, which is 30 minutes. I'm really getting a little bit of every answer, but 1 and 4 is really the main 2. All right. Remember, you want to give yourselves 1 to 2 minutes. You want to aim for the 1 minute part, but give yourself 1 and 2 minutes per question, max. All right. And then for all of you guys that already answered, tell me why this is that you got the answer you chose. First of all, what kind of medication is this? Drop it below. Drop the class of medication below while we bring up the answer to this question. All right, let me look at what y'all are saying. Those questions, awesome. All right, y'all ready? And drum roll, please. What is 1 hour? Did anybody answer what kind of medication this was? Let me see. Ooh, Ray of Sunshine said it's a form of antibiotics. I know that's right. Doctor said macrolide and ooh, Dr. 08 gave me, not only did they give me antibiotic, they gave me macrolide. Okay. Antibiotics. Awesome job. A lot of y'all knew that it was antibiotics. Great job. All right. So once again, the answer is what is 1 hour. All right. QD, this medication right here, I'm gonna call it QD, is an antimicrobial medication used to treat endocarditis, bacteremia, and infections of the skin. It is also, it also is used to treat infections of the urinary tract, central catheter infections, and bone, joint, and respiratory system infections. Right? For intermittent IV infusion, aka piggyback, the medication should be infused over a 1 hour period. Okay, so the answer was 1. Great job for all you guys that got that. Because I'm gonna tell you this right now, right here, right now, I got it wrong. When I went through it, I got this wrong. I chose 4. I chose 30 minutes. But snaps to y'all, y'all know I'm gonna always tell the truth. Okay, it is not about knowing everything, because you cannot. All right, no one knows everything. This is one of those questions that I would have got wrong, and that's fine. That's fine, because now I know that. Well, if you guys were me, but if I know that I was reviewing for my NCLEX and I got this question wrong during review, I know to make a mental note or to make an actual real physical note to review antibiotics, review this specific medication or this classification of medication, so that A, I can review it, refresh my memory, and then B, so that if I see something like this or a question about maybe this another type of medication within the same class, I won't get got again, because I learned from my first time, from my first error, from my first mistake, and did what I needed to do to review, so that next time I saw it, I wouldn't get it wrong again. So that's what you need to kind of mindset wise, that's what you need to focus on if you are getting questions wrong. All right, so great job to everyone that got what is 1. I am scrolling up to see who got it first. Hold on, let me bring up my scoreboard. All right, remember we have Sierra's Rich and Jay Ari with 500 points. We have Smell and Adam with 200 points. Jen Roll with 300, and then Smell and Adam for 200. So the first person to get this answer correct with another 500 is Smell and Adam. Ooh, Smell and Adam. All right, Smell and Adam, you had 200 points. You got this one correct. You were the first person to get this one correct, so you got an extra 500 points added. So that brings your score up to 700 points, making you the winner of tonight's NCLEX Jeopardy game. Whoop, 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 whoop. Great job. You also are the winner of a free Ultimate Nursing School bundle. Now, even though right now they're on sale for $25 versus the regular $97, so that, for everyone that didn't win, you can still get your life, okay? But congrats to you, you got it for free. All right, remember it is digital, but it's also printable. You must purchase the digital version first in order to be able to have the option to print it, okay? However, Smell and Adam, you just got it for free. All right, let me see what you guys are saying. Okay, perfect. Smell and Adam. If you have, I hope you have that other app that starts with an I and ends with an M. But if you have that other app, please DM me your full name, first and last, and a good email address so I can go ahead and send you your prize, our 400-page Ultimate Nursing School bundle. Okay, once again, it does not matter if you are in RN school or PN school, what state you're in. It is universal for all nurses in all nursing programs. This is based on the actual test plan that's covered in the NCLEX. This is the most and the commonly tested information, a bundle of that information that you must know, nursing students must know, whether you're in LPN school or RN school. Okay, so lab values, signs and symptoms, medications, pharmacologies, all that. That's going to be within it. All right, you have pharmacology, fundamentals, mental health, maternity, med-surg 1 and 2. That's only within the ultimate bundle. You have that within that bundle. So if that interests you, if you're a visual learner and you have issues, or you maybe have struggled in the past with getting information that you're studying to stick, make sure you check out the Ultimate Nursing School Bundle. Okay, it's great for visual learners, RNs and PNs, and it's only $25 versus the regular $97. Okay, this is only for today only. All right, this is our day 2 deal of our 12 days of NCLEX. You get a different deal every day, so who knows what tomorrow's deal was going to be. But for today, $25 Ultimate Nursing School Bundles will end at 11:59 p.m. Eastern Standard. So do not get got. Don't miss the boat. Don't miss the train. Don't do it. Okay, y'all better come over here and get you one of these. All right, link in bio. All right, so Smil and Adam, awesome job. Make sure you DM me that information so I can get that right over to you. Congratulations to everyone that joined in on this review. Okay, studying does not have to be boring. It does not have to be a walking panic attack. I know we're not going to enjoy it every time we study, okay? But when it comes to nursing school, half of it is mindset, okay? If you go into, your study area going, oh my God, I hate studying. Oh my God, this sucks, blah, blah, blah. You're not only going to be miserable, you're going to have PTSD, even worse, at the end of nursing school. You may or may not pass. No. Learning should be fun. Okay, you're learning something new. You should enjoy learning. And when it comes to, nursing, something that you should already at least enjoy, kinda, to get into this field. So it was very important for me to do whatever I could, whether it was gamify textbooks and reviews like NCLEX Jeopardy, just to make studying fun, to make learning entertaining, especially for nursing school, because depending on what program you have 1 to 4 years of intensity and you can quickly become burnt out. All right, so might as well be entertained and have a little fun, shake a little something while you're studying, while your life is going to be occupied for the next 1 to 4 years. All right, so if you guys are interested in NCLEX Jeopardy and participating in more NCLEX Jeopardies, make sure you follow my TikTok. On TikTok Live is where we'll have our live reviews on Thursdays at 7 p.m. Eastern Standard Time. If you want to go through and watch some of the ones that you may have missed, especially if this is your first time, if you want to kind of just review and go on a little replay spree, go ahead and subscribe to my YouTube channel, just at the Nurse Sam TV. Subscribe to my YouTube channel so you can watch those replays. You have Tease Tuesday replays, NCLEX Jeopardy replays, NCLEX review replays, as well as the replay of what to expect and how to prepare for the next gen NCLEX. I see some of you guys asking me about the next gen NCLEX, and we did a whole series a few weeks ago about it. If you missed it, it's okay. You can still click the link in my bio to grab the free mini guide of what to expect and how to prepare. And you can also watch the replay up on my YouTube. Both of those are free. Okay, now once you guys take advantage of the $25 Ultimate Nursing School Bundle deal, okay, you can definitely expect for the Ultimate Bundle to be updated in January of 2023 to now include tips, strategies, and practice questions specific to the next gen and NCLEX, in addition to the current NCLEX. Okay, remember, that's switching over April 1st, 2023. So up until then, from now until then, if anyone is taking the current NCLEX, the information is there still valid. Now, if you're taking the next gen information, if you're taking the next gen NCLEX on or after April 1st, the content is valid and the strategies are half valid, since it's a mixture of new and current NCLEX questions. But it will then include, as of next month, it will also include strategies for the next gen NCLEX. So you'll be covered either version that you're going to be taking of the NCLEX. And once again, that applies, and it's compatible for both the NCLEX PN as well as the NCLEX RN. Okay? Someone just asked me, is this for LPN or RN? For both. It's for all nursing students. Absolutely. All right, guys. Once again, if you want to play the mobile version of NCLEX Jeopardy, we went through about 8 questions. If you want to play the full 25 questions, hit the link in my bio and download the app. The app is called the NurseSam. Pretty straightforward. The NurseSam, it's available for iOS and Android. Go ahead and click the link in my bio so you can download that app and play the app exclusive NCLEX Jeopardy mobile. All right. You'll have these questions from tonight, in addition to like 17 more. Okay, a full 25 questions. Those questions change weekly. Okay, so in 30 seconds, okay, give me about 5 minutes, the questions will change over to this week's questions. So you can go ahead and get your review on anytime, anywhere, at your fingertips, as long as you have the app. Okay. All right, guys, thank you so much for joining me for this week's review. Make sure you join me and catch me next week. Okay, just make sure next week was not Christmas. Join me next week for, I almost said part 2, but it's part like 340. Join me next week for another session of our NCLEX Jeopardy. All right, thank y'all so much, and I'll see you then.